Hello, my name is Vasu Rao and I'm an interventional radiologist. I'm a local Houstonian. I went to Bel Air High School, Rice University, and then I went to Baylor College of Medicine. After completion of my medical school, I went to an interventional fellowship at MD Anderson Hospital and St. Luke's. Then I joined a private practice where I was the interventionalist performing many procedures throughout the Houston area. Over the last few years, I've developed a keen interest in venous disease. I subsequently opened Texas Vein and Wellness, where I could focus my interest in the diagnosing and treatment of venous disease. At Texas Vein and Wellness, we treat exclusively venous disease. And with that, we develop a sense of competency because it is the only thing that we do. Patients present to us with leg pain, leg swelling, burning, itching, cramping, a host of symptoms, and we begin with a very complete diagnostic exam from a physical exam as well as an ultrasound. And if treatment is needed, we provide that treatment here. We like to take care of our patients in a personal manner. All my patients will receive my cell phone, they see me personally, and we are in constant communication throughout the treatment process.
My name is Kim Jensen, 41 years old. I met Dr. Rao through the restaurant that I manage and talked to him about just my symptoms of heavy leg feeling, tired leg syndrome. I had a couple of veins that I noticed were getting a little more blue than I liked, and so I just talked to him one day and he told me that this really is a more serious thing probably than just like a cosmetic issue. So he had me come out, did the ultrasounds, checked everything, and he was even surprised. He's like, "You're pretty young to have such a severe case of this." And he was like, "This is what we're gonna do, action plan." Jumped right into it. I was pretty nervous to start this process. I'm not one that likes going to doctors. So it went so well. I was very comfortable. The staff here, they just made it really easy. And so I've just been, symptoms, everything feels great. My legs feel awesome. I can work a 12-hour shift on my feet. And it was a great experience.
When a patient comes in, I honestly approach them as, if this was my mother, if this was my wife, what would I do? Does she need this kind of treatment, or she needs that kind of treatment, or she maybe needs no treatment? The point is, what would I do? I use that as my standard because that's how I would want to be treated. I want someone to treat me as if I was a family, and that's what we do here. Because there's no sense in treating people that don't need to be treated. And so when you come here, you're going to be part of our family. And we're at the end of your session with us, you'll know what's going on with your legs, and you'll be given different options of how the treatment process can go. And so that's what I pride ourselves on, in that we treat you like family.
Hi, I'm Joanne Taylor, and I had a very serious case of varicose veins, and it actually started after pregnancy, and it just got increasingly worse, where I would have cramping at night. I would have tiredness, soreness, and I couldn't walk very well after a long period of time. Especially when I would travel, my legs would swell much more than normal, although it did swell quite a bit, probably every day. I was referred to Dr. Rao through my primary care physician, who knew him, and I decided with my husband that this is something we needed to take care of, as it was getting increasingly worse, particularly at the end of the day and at night. Dr. Rao resolved my problem. Although this did not happen overnight, after a period of 3 to 6 months, the significant difference was I no longer had the cramping. I could walk properly, and I didn't have any swelling, and my quality of life greatly improved. And I am still improving as of today. Also, his care, his follow-up, the staff, and Dr. Rao's expertise in correcting my situation was excellent. And I would highly recommend this office and him.
I mean, I think patients love coming here because I think they feel we're one with them. We're like family. We know about their kids. We know about their work, and they communicate those things. We get to know them over this process. It's not a one-time deal. It's a treatment process. And as they come in, we know about their kids and where they are in school, and we enjoy that. We connect with them because they're really like us. They're part of our extended family at Texas Vein and Wellness.
My name is Carl Cooper. I had varicose veins since I was about 18. It was a hereditary thing. I played professional golf for a living, so I'd always had some achiness in my legs. And then it got to the point where I realized one morning I woke up and I had a real hard spot in my right leg, and I needed to do something about it. I met Dr. Rao, and he had told me that he was going to start doing this procedure on varicose veins. So I came over to his office, and I was very surprised, to be honest with you. He looked at my legs. It was something I'd had for 35, 40 years. And on the first treatment on my right leg, within, I would say, 2 to 3 days, there were no veins left there were no varicose veins. I was very surprised that it could happen that quickly. I went to my left leg. My right leg was the worst leg, so that's what we did first, and couldn't believe the healing of it. Even some of my friends said, "Man, that's unbelievable." And grown men would say, "Wow, I can't believe your leg looks like that." So and then I did my left leg, and it worked out exactly the same. The other leg wasn't quite so bad. The left leg wasn't quite so bad. But yeah, it's amazing. I didn't really know what I was missing, to be honest with you. I didn't know, because when you live with something like this, you really don't know if it's something that's bothering you that much or if it's going to make that big a difference, because you get used to the pain and the pressure there. But yeah, both legs were done about 2 months ago, a month and a half ago, 2 months, and they're still healing up even more. And I can sense that when I go to the gym that my legs are becoming stronger, and it's a relief. You know, you don't think of it like that, but it is quite a relief when you've lived with something your whole life that you know isn't right, and yet you kind of put it off. But when you finally do it, you realize, oh man, yeah, this is a big difference.
Quality care to me means that we provide our patients with the latest in equipment and the latest in technology, and provide it in a very compassionate, caring method. Patients, I think, like the fact that we are very accessible, that we are available if they need us, and we're friendly, and we're always have their best interest at heart. We are very result-oriented in the sense we like to see our patients improve. We love it when our patients come back and say that they were able now to walk to the store or walk in the park when they were at home prior with leg pain and cramping. We like to see results that indicative of a good treatment outcome, that they've improved, that the symptoms that brought them here are resolved.